You think cleaning out an old shed is harmless. You sweep up dust, move some boxes, maybe disturb a mouse nest you did not know was there. A few days later, you feel tired, then comes fever, then muscle aches. You assume it is the flu, but this is not the flu. This is hantavirus, a rare but deadly infection that enters your body through something as simple as breathing. And by the time most people realize what they have, the virus has already begun attacking the one system they cannot survive without. The scariest part? Your own immune response is what causes the damage. Here is how it starts. Hantavirus lives in rodents, particularly deer mice in North America. The virus does not make them sick. They carry it silently, shedding it in their urine, droppings, and saliva. These materials dry out and become dust. When you disturb that dust, sweeping a cabin floor, cleaning a storage shed, moving hay bales, tiny particles become airborne. You breathe them in without realizing anything is wrong. The virus enters your lungs, and this is where trouble begins. Most people miss this part. You do not have to see a mouse. You do not have to touch droppings directly. You just have to breathe in a space where infected rodents have been. One deep breath is enough. The virus attaches to cells lining your respiratory tract and begins to replicate. For the first 1 to 5 weeks, you feel nothing. The virus multiplies silently. You have already forgotten about the dusty shed. You have no idea what is coming. Now this is where it shifts. The first symptoms appear suddenly. Fatigue hits hard. Fever spikes. Muscles ache, especially thighs, hips, and back. Headaches, dizziness, chills, nausea. It looks exactly like the flu. Most people treat it like the flu. They rest, drink fluids, wait for it to pass. But hantavirus does not pass. It escalates. Here is what your body actually does. Your immune system finally detects the virus and launches an aggressive response. White blood cells flood to your lungs, inflammatory signals spike. Your body is trying to fight the invader, but the battlefield is your own tissue. The blood vessels in your lungs become damaged. They start to leak. Fluid that should stay in your bloodstream pours into the air sacs of your lungs. This is called pulmonary edema. Your lungs are literally filling with fluid. This is hantavirus pulmonary syndrome. This is where it gets worse. Within 1 to 2 days of initial symptoms, breathing becomes difficult. You feel like you cannot get enough air. Your heart races. Blood pressure drops. Your lips and fingertips may turn blue from lack of oxygen. The transition from feeling flu-like to fighting for your life can happen in less than 48 hours. And there is no antiviral drug that stops it. No cure. Only supportive care. Oxygen, mechanical ventilation, intensive monitoring. And this is the part most people never realize. The virus itself does not destroy your lungs. Your immune system does. Hantavirus triggers an extreme inflammatory response called a cytokine storm. Cytokines are signaling molecules that coordinate your immune attack. In a normal infection, they help. In hantavirus, they overreact. The flood of immune activity causes more damage than the virus ever could. The same response that clears a common cold is what floods your lungs with fluid. Let us talk about survival. Hantavirus pulmonary syndrome has a fatality rate of about 38%. More than 1 in 3 people who develop the severe form do not survive. Those who do often require intensive care, intubation, mechanical ventilation, sometimes machines that oxygenate blood outside the body. Recovery takes weeks to months. But here is the critical insight. Hantavirus is almost entirely preventable. You cannot catch it from another person. You catch it from rodent environments. Prevention comes down to one thing: avoiding exposure to rodent droppings, urine, and nesting materials, especially in enclosed spaces where dust becomes airborne. Here is what prevention looks like. Before entering a space with possible rodent contamination, a cabin closed for months, a storage shed, a barn, ventilate it first. Open doors and windows. Let fresh air circulate for 30 minutes before going inside. Do not sweep or vacuum droppings. Sweeping throws particles into the air. Instead, wet down contaminated areas with a bleach solution, 1 part bleach to 10 parts water. Let it soak 5 minutes. Wipe up with paper towels and dispose in sealed bags. Wear rubber gloves. Wear an N95 mask. The goal is to never let dried rodent material become airborne. Rodent control is the long-term solution. Seal holes where mice enter buildings. Store food in rodent-proof containers. Trap mice around living spaces. The fewer rodents, the lower the risk. Who is most at risk? People working in rural settings, farmers, ranch hands, people cleaning buildings that housed rodent nests, hikers and campers sleeping in shelters or cabins. You do not have to live in wilderness. A suburban garage with mice can harbor hantavirus. Here is why early recognition matters. If you develop flu-like symptoms within 6 weeks of potential rodent exposure, tell your doctor about that exposure. Most doctors do not think of hantavirus because it is rare. They assume common flu and send you home. But knowing you cleaned a shed or cabin changes everything. Early recognition means earlier intensive care if disease progresses. It does not change treatment. There is no specific treatment, but it changes readiness. And readiness saves lives. Your body responds to hantavirus exactly as designed, launching an immune attack. The problem is, the battlefield is your lungs, and the flood becomes literal. This is not a flaw. This is an overreaction to a pathogen your body never evolved to handle efficiently. The virus is rare. Most people will never encounter it, but for those who do, understanding the source, rodent contamination, and the mechanism, airborne dust, transforms a mysterious deadly illness into a preventable one. Ventilate before entering. Wet down before cleaning. Wear protection. Control rodent populations. Hantavirus does not hunt you down. It waits in dusty corners, dried droppings, abandoned spaces. It requires you to come to it, disturb it, breathe it in. That means you have control. The shed, the cabin, the barn. These are risk zones. Enter wisely, clean carefully, and hantavirus remains what it should be. A threat you never face because you never gave it the opportunity.